Hi everyone. We'll be discussing endocrine disorders and nutritional management. My name is Dr. Jumoke Georgina Ilo. Our outline for today is pathophysiology of major endocrine disorder, diet therapy in diabetes mellitus, dietary approaches in thyroid disorders, nutritional consideration in pituitary disorders, and lastly, the role of the dietitian in the endocrine management. There are glands that secrete hormone directly into the bloodstream, and this hormone rather helps to regulate metabolism, growth, reproduction, stress responses, and tissue functions. When we bring in these glands together, we can say they are the endocrine system. When these glands malfunction, we could have hormonal imbalances and can lead to metabolic or systemic disorder. And oftentimes, we require long-term dietary and medical management. Diabetes mellitus have been seen to be the most common endocrine disorder, and this can result from impaired insulin secretion, insulin action, or both. There are three types. We have the type 1, type 2, and gestational diabetes. For type 1, there is autoimmune destruction of the pancreatic beta cells where there's absolute insulin deficiency. And for type 2, there is insulin resistance with relative insulin deficiency. That is, the there is insulin, but it is not active, or we do not have enough insulin. Then thirdly, we have the gestational diabetes, and this is generally referred to as pregnancy-induced diabetes. We have nutritional goals we want to achieve when it comes to the management of diabetes mellitus patients. We want to maintain the blood glucose level of the patient. We want to achieve healthy body weight, especially if the patient is overweight. We want to prevent or manage complications as fast as possible. And we also want to coordinate food intake and medication. Food intake with medication rather, or insulin. The dietary principles for the management of diabetes mellitus. We have the carbohydrate management. Of course, we will not restrict the intake of consumption of carbohydrates in patients with diabetes. Rather, we will distribute carbohydrate intake evenly across the meals. We will emphasize the need for low glycemic index food, which can be gotten from food source like the whole grains, legumes, vegetables. We will limit the refined sugars consumption, and as well as the sweetened beverages. We also make use of carbohydrate canteen, especially for patients who are using insulin. For protein, we will encourage moderate intake, except for patients with kidney disease, which we will need to adjust based on the nephropathy stage. For fat, we will reduce saturated and trans fat to lower cardiovascular risk, and for fiber, we will increase their consumption in order to improve glycemic control. Oftentimes intake of high fiber has been seen to, delay the emptying of the stomach, and this can really help in improving the glycemic control of our patients. There are special consideration we should look into, and this include hypoglycemia management in insulin-treated patients. For patients who are being treated using insulin, even though the diabetes is as a result of hyperglycemia, they can also experience hypoglycemia, and this should be managed. We also have the pregnancy adjustment for gestational diabetes. We don't want our babies to come out as microsomia. We don't want our patients to grow up to go later in life and be susceptible to diabetes. We need to manage um gestational diabetes, and there is need for pregnancy adjustment during this period. For patients who are hypertensive, there is need for us to restrict sodium, and we also need to know that we need to complement nutritional therapy with physical activities and medications. Thyroid disorders and diet therapy. The thyroid glands seem to regulate metabolic rate through two main hormones. We have the thyroxine and the thyroxine and the triiodothyronine. We have the type hyperthyroidism and the hypothyroidism. For hypothyroidism, there is excess thyroid hormone leading to weight loss, increased metabolism, and nutrient depletion. Nutritional management in this period, or in this case, is for us to increase energy and protein intake so as to meet the high metabolic needs of the body. We also need to monitor the calcium and vitamin D to prevent bone loss risk. We also need to ensure that we avoid excess iodine intake, which may worsen hyperthyroidism in our patient, and we need to manage diarrhea, fluid imbalance, and stress-induced catabolism. For hypothyroidism, this is a period whereby there is a low thyroid hormone, and this can slow metabolism. It can lead to weight loss, fatigue, and constipation. General management in this period is for us to ensure that there is energy control diet to prevent excessive weight gain. We need to increase fiber, selenium, and also zinc in order to support thyroid function. Our fiber, our patient fiber needs should also be increased to prevent or manage constipation, and also we need to ensure that it doesn't interfere with the thyroid drugs. There's need for for our patients to consume food which are not high in goitrogen, which can prevent the uptake of iodine in the body, although cooking can reduce this effect. And then the proper timing of this medication is also important so as not to interfere with the absorption, with its absorption, especially when we combine it with high fiber. For pituitary disorder and nutritional issue, pituitary disease have been seen to affect hormone secretion that regulates metabolism and fluid balance. We have the growth hormone excess, we have the growth hormone deficiency, we also have diabetes insipidus. For growth hormone excess, this leads to insulin resistance and increased energy need. And there's need for us to focus on blood sugar control, and for growth hormone deficiency, we may need to ensure that there is adequate protein and energy to support growth, especially in children. And for diabetes insipidus, we need to ensure that there's fluid replacement, moderate sodium consumption, and also monitor hydration, because in this period there is excessive fluid loss. Let's look into the polycystic ovarian syndrome and diet management. For PCOS, this involves hormonal imbalances and insulin resistance, affecting reproductive and metabolic health. We have our nutritional goals in this period. We want to improve insulin sensitivity. We want to promote healthy weight loss, and then we want to ensure that there is a regular menstrual cycle. There are key dietary approach we can look into. The need for us to include low glycemic load diet into the diet of our patient. The need for them to consume high fiber and also avoid refined carbohydrates and sugary food. It's essential for us to combine this activity with a physical activity so that we can have enhanced outcome. It's important to also discuss nutritional support in other endocrine disorder. We have hyperparathyroidism, hypoparathyroidism, and menopause. For hyperparathyroidism, which leads to elevated blood calcium, we will need to avoid excessive calcium and vitamin D, and also ensure that we maintain hydration. And for hypoparathyroidism, this will require high calcium and active vitamin D intake. Vitamin D have been seen to help in the absorption of the calcium. For menopause, we need to encourage subjects to eat or consume food that are rich in calcium, magnesium, vitamin D, and phytoestrogen. We also need to ensure that there is a weight management in order to reduce cardiovascular risk. Finally, let's discuss the role of dietitian in endocrine disorder. The role of dietitian in endocrine disorder cannot be overemphasized. Their role is very crucial, very important. And first on the list is conducting nutritional assessment. You understand that dietitian will need to conduct nutritional assessment, looking at the dietary history of the patient in order to make or suggest necessary amendment or adjustment, in the patient's diet. There's also need for lab results and clinical science so as to ensure that we have the correct assessment of our patients before we can give the needed advice, nutritional advice. We the dietitian also is important in developing individualized nutritional care plan. Of course, we will not give a general care plan for our patients. We understand that our patients are unique, individual are unique, and we will not be giving all fit cut for all patients. Rather, we would individualize this nutritional care so that they can achieve optimal results. Dietitians also are important in monitoring glycemic control, lipid profile, and weight changes and symptoms of our patient. This is very crucial. How do we know if there's progression if we don't monitor this? There's also need for dietitians to educate their patients on meal planning, portion control, and label reading. Imagine if your patient has to adjust or restrict particular food without the knowledge of label reading. They will not be able to achieve this thing. So there's need for us to educate them, let them understand the need to read labels of food, the need for them to portion their food, and also the need for them to plan their meal. There's a need for adjustment in preparation. It's very important. This is the role of a dietitian. Dietitian too is also seen to coordinate with physicians for medication adjustment. We know what our optimal goal is for us to register progression on in the health, positive progression in the health of our patients. And when there is a positive progression, we know that for patients who are on drugs, their dosage can be reduced, or the frequency of intake of these drugs can be reduced. So there's need for us to work hand in hand with the physicians so as to adjust medication where necessary. Lastly, there's need for us to support the lifestyle behavior of behavioral change of our patients. Having to modify patients' diet, having to adjust their dietary needs, all depends or lie in the lifestyle behavioral change. People eat what they eat because of their background, their culture, their lifestyle, their behavior, and it is the role of the dietitian in supporting the lifestyle behavioral change of our patients. Let me end by saying that therapeutic nutrition is not a substitute for medical treatment. Rather, it strengthens metabolic control and also enhance quality of life. At this junction, it's good to say thank you for listening.